Join our expert today, an ONG and maternal and fetal medicine specialist from South Africa, as she explores menopause beyond physical changes, from emotional well-being to mental health.
Hi there, I'm Dr. Sarantha Fulchand from South Africa. I'm an obstetrician gynecologist and a maternal and fetal specialist. I typically encounter many menopause patients in my practice. About 20 to 30% of consultations are patients with menopause. So what we don't realize is that patients may come with direct symptoms or indirectly because they're in the perimenopause period. And the direct symptoms may be the vasomotor symptoms such as hot flushes, night sweats, irregular periods, mood swings, urogenital changes, or indirectly such as changes in sexual health, weight changes. There are so many misconceptions that South African women have surrounding menopause. Most women feel that they must just suffer through it, that nothing can be done, there's no help. Women often believe that these symptoms are inevitable and untreatable, and that the HRT options or treatment options are actually unsafe. Other common myths that we encounter is that HRT is too dangerous for everyone. And what we know is that actually the risk is individual and often low when appropriately prescribed. Women also feel that menopause only means hot flushes, but we know that this is not true. Menopause affects sleep, sexual function, bladder health, bone health, as well as the heart. I often hear patients thinking that you only need help after your periods stop, but the perimenopausal period does convey significant symptoms as well, which are treatable. Another misconception is that vaginal dryness is normal with age and cannot be treated, but we know that there are local estrogen and non-hormonal options which are safe and effective for most people. In my own experience, my own mom had such difficulty in talking about the menopause and her experience with it, and it just illustrates that even with me being an obstetrician gynecologist, there have been so many barriers that have been carried over through generations, which makes it difficult for women to talk about the menopause. Urban women, on the other hand, have greater access to their GPs and OBGYNs, including other diagnostic options. So they definitely have more exposure to media and information leaflets, and sometimes higher quality, but can also be more confusing. I think that community health worker engagement in rural areas can be a powerful tool when they are trained to recognize and discuss menopause and the symptoms with the patients. There are various public health measures that South Africa can implement urgently. The first being a national clinical guidance on menopause care. It should be context-appropriate algorithms for the perimenopause and the menopausal period, clear guidance on HRT initiation, its monitoring, contraindications, and non-hormonal treatment options. There should be guidance on genitourinary syndromes, its management, and bone health screening. Another area is training and task sharing, CPD modules for GPs, nurses, midwives, community healthcare workers on menopause, as well as first-line management is essential. What's needed is public awareness campaigns. We need to normalize discussing menopause and highlight that effective treatments do exist and help counter myths. And I think 3 important priorities that could be immediately actionable are publishing a national primary care guideline, guaranteeing the supply of medication in public clinics, and the rollout of brief menopause training for frontline providers with simple triage tools. So guys, let's normalize talking about the menopause and the myths surrounding menopause and hormone replacement therapy and continue this conversation on a more global scale.
Stay tuned for our next episode in the Menopause Talk series, and don't forget to watch the full documentary on menopause by clicking the link here.